My name is Henry Wilkes, and I worked with the athletic trainers this semester for my internship. At the beginning, we had that Zoom meeting, and everyone went over kind of what they want to do with their life, and I wasn't too sure. So I said either athletic training or physical therapy. So this semester is a good opportunity to work with the athletic trainers to see if that's something that I want to do with my life. My main role was just to kind of learn and ask as many questions as I could to see if this is something that I wanted to pursue. I would also help the athletic trainers in any way that I could to kind of lighten their load. So if they were occupied with another athlete, I could remove cups from another athlete or stim pads, just things like that to kind of make it easier for them, which kind of goes along with my responsibilities. As at the beginning of the semester, I didn't know much about athletic training or any of the different modalities of treatment, rehab, stuff like that. So I felt like there wasn't much that I could help or do to, I didn't provide much to the athletic trainers. But definitely as that went on, which kind of goes into my accomplishments, I'm kind of proud of learning more about these treatments and being able to do them on my own without the help of the athletic trainers. Some of my friends would come down at the beginning of the semester and ask for cupping, which I actually have a cupping set myself now. And they'd be like, can you put cups on my shoulder or my back? I'm like, I'll try, I don't really know the proper placement, but I'll do my best. And so there's like these different modalities of treatment. Obviously cupping it's more just feel good treatment. So what it'll do is it'll just suck your skin in like this. Then you can perform exercises with them on, and it'll just increase blood flow to the area. I do also have a massage gun, so there's a lot of these kind of treatment options in the athletic training room, and a lot of them are feel-good options. So if you come in after a difficult practice, it's not going to cure everything, but it'll help you perform or maybe practice at the high level the next day. Some of the challenges I faced were finding the time to complete all my hours, especially being on the swim team. So having practices, lift, and then classes, I couldn't be down there for long periods at a time, especially with the spring semester. Since we had a bunch of breaks and long weekends and stuff like that, it was hard to get a lot of the hours in. And then I also talked about it already, but not being trained at the beginning, so just kind of having to watch. But now I feel more comfortable with stuff like ultrasound and STEM and a lot of different modalities of treatment. One of the trainers, I was working with two trainers primarily, since one was gone with baseball a lot of the time. The other one was the women's soccer. And so obviously soccer, dealing with a lot more lower body injuries, hips, legs, knees, stuff like that. And then when the athletic trainer for baseball was here, it was a lot of overhead movement, so shoulders, forearms, more stuff like that. So I got to see all different types of injuries and treatment options. I just tried to ask a lot of questions to gauge like what they enjoy about their job, what they dislike, and pretty universally they said it was very difficult working with entitled athletes. They are people too, and they said like they're there hours before practices, before games, and after. And people like demanding they see them at this time is difficult because they want to have lives and stuff outside of work as well. But their jobs are a big part of their life, so the athletes kind of, I think, take them for granted, assuming they can just see them whenever and wherever they want. And so the athletic trainers I did talk to said they were, overworked and underpaid, which it makes sense because, especially in the realm of college athletics, it takes a lot of your time, which kind of, to wrap things up, kind of steered me away from athletic training, because one of my goals is to have time for a family, like kind of personal time, and give back the same attention that my parents did for me to, my future kids. So I think physical therapy in a more clinical setting would suit me better.